Hi, I'm Rebecca Scott, the outpatient social worker on the UC Health transplant team. You probably already know me from the pre-transplant clinic, and I will continue to see you in our post-transplant clinic. As we discussed in the pre-transplant clinic, there are some psychosocial risks for post-liver transplant patients, and this video will help you to deal with any emotional issues that may come up while you're adjusting to having a liver transplant. Aside from this video, however, I will also help you with any emotional stress you may feel at post-transplant clinics. Just remember, it is important to call me or request to see me in clinic if you have a question about your mental health, transplant medications, family and friends, and alcohol and drug use. Many of our post-transplant patients do not experience any emotional issues with their recovery, but some patients will experience symptoms post-transplant. Some of these symptoms include increased anxiety, depression, irritability, or any other mental health symptom. You may also experience guilt feelings about the transplant itself, and you're at risk for post-traumatic stress disorder due to the stress of having a transplant and the recovery process. If you feel any of these symptoms, you can discuss this on the phone or in the clinic with me. I can make a referral for a therapist that can help you deal with these feelings, as well as refer you for a psychiatrist who may be able to prescribe medications for a short period of time to help you through this process. If you have a diagnosed psychiatric disorder and you're currently taking medication or seeing a therapist or psychiatrist, it is important to monitor your psychiatric symptoms after a liver transplant. If your anxiety or mood worsens after a transplant, you should see your mental health providers for treatment. After your transplant, you will be on prednisone as well as other immunosuppressant medication. Like other prescriptions, these medications do have some side effects, and some people may experience mood changes, increased irritability, and anxiousness in the first few months during recovery. If you do experience these symptoms, it's normal. They are short-term, and most patients stop experiencing these symptoms after the first 3 months. After your transplant, it can be difficult for family and friends to adjust to changes in your behavior. But I frequently meet with patients' family members to help them understand the difficulty our transplant patients have adjusting to post-transplant regimen of care. Often it is difficult for patients to rely on others to help them after their transplant, but it is important for you to allow your support system to help you through the process. Many times those who support you through your recovery have helped to support you through a long illness, and it's harder to let go of that role. Always remember that your need for transplant is urgent, and you and your support persons may not have had time to adjust to the idea of having a transplant. If any of these issues arise, I will be there to discuss them with your support persons in your clinic visit with you. Patients who have had a history of drug or alcohol abuse or dependence can sometimes experience some difficulty post-transplant. In the pre-transplant phase, many patients have been required to complete substance dependence treatment to learn new coping skills and insight into your alcohol or drug use. And while most patients feel that they will never drink alcohol or use drugs again after a liver transplant, the reality is that 20 to 25% of patients with alcohol cirrhosis will relapse on substances post-transplant. When you start to feel better, you may start having urges or cravings to use alcohol or drugs. If you do feel this urgency, please know that I am available in the post-transplant clinic to discuss any issues that you may be having with alcohol or drugs. Our goal is that you not use substances post-transplant, so it is better for you to tell us when you are having cravings to use alcohol. It is also important to tell us if you relapse, because it can interfere with the way we manage your treatment. If you do relapse, it is key to find help to stop using these substances as soon as possible. Always remember that I'm available to help you find resources that will allow you to accomplish this goal. Transplant surgery is a life-changing experience, and I want to help you and your loved ones cope with this. I hope this video will help you during your recovery, but if you have any further questions or feel emotional stress after your transplant, please call me as soon as possible.